Hi, I'm Sally Bevins. I'm the Vice President of Image Medical. Image Medical is the second longest standing in the industry for both microneedling and skin analysis devices. I'm going to walk you through the Image Pro today. This is going to help complement the laser course in a number of different ways. We understand that the second hardest part about having a med spa is once a person's in the door, converting them to treatment acceptance. And that's exactly what this is going to do. So it's going to help you sell all of your laser treatments. Today, I'm actually going to walk you through how we can effectively utilize the Image Pro for a consultation. I have a beautiful model here, and she's going to allow us to take some images, and then I'll walk you through that in just a second. So this is Fiorella. She's going to take a couple of images with us. So I'm going to have you put your chin right here and your forehead right here on those two little dots, and I'm going to close this hood over your head. And I'll get to why we use the hood. I've already collected her name and her birthday, which are the most important. I'm going to register her and start the images.
Put your chin and forehead on the pedestal and close your eyes. Let's start shooting.
Eyes closed.
The shooting is over. Just a moment, please.
Okay,
when
and
the hood is
all done.
Please step
Thank
back
you so
slowly.
much. We're going to do a moisture read. So we do have a moisture checking. This is going to help with your laser and other treatments as well, and I'll explain why in a minute. So forehead.
Measure moisture. Measure your forehead and cheeks with a moisture meter.
Right cheek and then left cheek. Okay, awesome. Thank you so much. So we have just finished taking her images. We then do a moisture reading. It does a moisture reading of her forehead, her right cheek, and then her left cheek. And this will all be a part of what we go through as a part of the consultation and positioning of the different devices and modalities that you have in your practice. So we're going to go to Analysis Start. And you will have seen that the whole process in just taking the images, taking the moisture was very, very quick. So this isn't something that's super time consuming. The consultations can be as long and as detailed as you want them to be, and I can show you all of that, but it can also be quite quick if the purpose of bringing something on like this is to expedite and streamline your consultation process.
Start skin analysis. Just a moment, please.
So it does allow you to set the criteria. Some of our practices, I just had one call me the other day, they said, we do a lot of perioral. They were actually a dental spa. And so around the mouth is something that's very important to them. When you set your zone and criteria, you can move those around to accentuate or to make sure that those are different things that you cover. Now, this is the first screen that comes up. This is kind of the summary. And what I like to say is, you can come back to this at the end because it is in fact a summary. It's kind of an overall of everything. You can start here if you want to and follow the procedure of the interface or follow the flow of the interface. In this situation, what I like to use is anything in blue is good. Anything in red is something that we need to address. And so that's what's going to allow you to explain to them, you know, this is where you fall based on people that are of your age and demographic. And this is, you know, what we have in our practice that we're going to help you treat those situations, those skin issues, okay? So she's 36 and her skin age is actually 34, so she's doing very, very good. And like I said, I'm gonna come back to all of these, but what I do like is the skin texture and the pores are noted with these little arrows, okay? And these are the two things that we would concentrate the most on with her. Now, when we go into the images, which I'm gonna do now, skin and an age is where you start and you have pores. So what it does is it actually accentuates the pores. Her pores aren't this bad, but it does kind of magnify her face. It uses a specific filter. There's actually 4 different filters that are used to capture these images. And there's ways to show them as well. So this is how it defaults, but if you just wanted to do it in black and white, you could see where her pores are, where they're larger versus other. Now, one of the things I like as well is we can click on certain areas. We can blow them up, zoom in on them, make them 3D, and then you can actually chromatize and digitize these and use these later on, so you can save them down here and use these as you're going through your treatment plan with them after the fact to show improvement over time in a very quantifiable manner, which is really difficult to do if it's just being done with the naked eye. Okay, so then it will go into wrinkles. Same thing here. It does accentuate the wrinkles. We know that wrinkles are where your pores start to align. Okay, so it will highlight those in blue. We see one right here. So this would be another place where you could get really close in with that one. And then save this again as a way to quantify your results as you go throughout your treatment plan. Nasolabial folds. So I'll point this out too. On each page, you actually have a gradient level essentially of her and her age based on all of those others that are her same age demographic. Now, this will actually change if I'm in Vermont versus if I'm in Texas. It will actually change if you're in certain areas of Texas versus others. If you were in Africa, it is very specific. This technology specifically has been around, these skin analysis systems have been around for 15 years. And so, despite the software continually to upgrade and change and be more beneficial, we have hundreds of thousands of analyses that we are comparing these to over the years. Okay, so these are very accurate results. Okay, so nasolabial folds. What I love about this is a lot of people think, I don't need this if all I'm doing is injecting, or if that's the main proponent of my business. There's a couple of ways here that you can actually utilize these for injectable practices. The nasolabial folds are of course, one of those. Okay, so a lot of times patients come in and they think, I only need one syringe of filler. And a lot of times they think, I only need one syringe of filler because that's all that they can afford. So, how are you, the practitioner, going to explain to them in a quantifiable and objective manner, we actually need more than that? So, in the nasolabial folds, it will actually accentuate right versus left. And if there's a void or a lacking on one side versus the other, in this side, you see that the right side needs more intensive treatment. And so, me as the practitioner, I'm going to say, listen, I know we were talking about maybe just doing one syringe, but on this side, I'm probably going to have to put 3/4 of a syringe, whereas I'm going to have to put half a syringe over here. Now you've moved them away in a manner that the system is telling them you need more than one syringe of filler. But let her know and let your patients know, like, you're doing really, really good. Your skin is amazing. Your nasolabial folds don't need addressed at this point. Moving on. Elasticity. I remember when I first started looking at this system, and I couldn't really, I didn't know until I got into it. These are just these yellow lines. But if you see over in this left-hand corner, it actually shows when those lines are angled at a certain degree, where the issue lies in the elasticity. So if it's bad, if it's good, or indifferent. So these will show you the angles. This is the other part that I love about injectable practices. A lot of what we're seeing now in social media is this influx of people looking for facial symmetry, right? So you actually have an angle here, and it shows you on this side she has a 55.2 degree angle, and this side she has a 53 degree angle. So if we were doing facial symmetry and we wanted to put in jawline fillers, again, this is your opportunity to say, hey, we need to fill this void over here in order to provide you with that facial symmetry. So we're probably going to use 1.5 syringes over here and just one over here. Now you've moved them to multiple syringes. Now you've gone beyond that kind of that crutch or that issue that you're having to get over of them having this preconceived idea of how much filler that they need. The other thing too here is the angle. Again, this is partially for elasticity, but this is going to help them show if we're doing mid-face fill and there's a void on one side versus the other, we may need to use some filler here in the cheeks for a mid-face fill. Still, she's better by one gradient than everybody in her age. So she's doing really, really well in elasticity. Now, if we were talking about elasticity versus fillers, okay, we're going to be talking about fractional RF. We're going to be talking about microneedling. We're going to be talking about fractional resurfacing, RF microneedling. Those are all different things that are going to help improve the elasticity of the skin, peels, all different kinds of things. And it's whatever you guys have. So my favorite part of this is you see this little cart here. The first thing you're going to do when you get this system, and I'll kind of show you at the end, is you're going to log in, become a partner, and you're going to upload each and every one of your products and all of your services on an individual basis and then in a package basis. And then if you offer memberships, you're going to put those in there as well. Now, you'll have those grouped in that manner. It will also allow you to group it on the skin issue. So if they have oily skin, pigmented skin, lax skin, etc. So you can bulk load each one of those products and services into those, so it makes your treatment recommendations as you go through this analysis even easier. So say, for instance, elasticity was her issue, which it's clearly not. And we were going to recommend, because this is what we have, we're going to recommend a CytoRF RF microneedling treatment. So we're going to go to the cart, and it is going to be loaded. All of your products and services are going to be here, and then you can see a breakdown of each one of the different kinds of skin issues that the analysis highlights, okay? So if you had it in elasticity and your CytoRF RF microneedling was here, plus you're probably going to want her to get on a retinol of some sort, whatever products you have, you're going to bulk load those into elasticity, and you're going to move those into your cart over here, and then it saves that on her treatment plan at the end of the report. And I'm going to show you how you can share the report, the full thing, all of their images and everything with them, so they can take it home with them. Moving on to skin texture. Again, highlights that skin texture. It does say in this situation, her right side is worse than her left side. Sometimes a lot of times we see left versus right, and our left side is our driving side. But if we tend to be right side sleepers, that could be a part of that as well. So she's actually 7 worse than those of her age. And so texture would be an issue that we would want to accomplish here. So something like hydrodermabrasion, so the cytopeel, for instance, she could come in, and we would probably put her on a membership model. Come in every month, have this treatment done, or these different treatments as a part of our membership model. So again, you'd go to your cart, you'd click on the membership and move it over. Okay, skin pigment. I love this because it shows, this is your epidermal pigment. This is what we see with our naked eye. So it will show you those existing pigmented lesions. Again, you can break those up and show them in different, more effective, less effective manners. Whatever's most impactful for you, or that you like. A lot of this is a matter of preference. It does highlight areas of most concern, again, her right side and on her nose, but she is 8 gradients better than everybody else her age, so she's doing really well here. UV spot. Now, I love this because this is your opportunity to say, okay, I mean, hers is great, but if they had a lot of underlying pigment, this is pigment that we can't see with the naked eye, that if we don't address this now, if you don't start using sunscreen, if you don't use a tyrosinase inhibitor, if you're not using hydroquinone, if we're not doing regular IPL treatments, okay, this is what your skin is potentially going to look like. So it's kind of like a little bit of a scare tactic, but in all honesty, that pigment's there and it will come to the surface if they don't do these treatments that you're offering them. Skin tone. Now, this is the naked eye. This is the filter that's not really a filter. This is showing them really what their skin looks like, what they see in the mirror every day. That's why this is the image that you're going to use when you're showing them their results. So, and this is also the image that you're probably going to use on all of your social media, on your website, to show those. And what I love about this as a whole, and one of the main reasons to have skin analysis devices, unless you have a room that's just got the whole setup, no natural lighting, a camera in a certain place, little footprint thing, or the foot placement things, the skin analysis device allows you to take perfect images where they're actually centered on a little chassis, if you will, in the imaging station. It will actually take front and both obliques. There's the little prongs you'll see in there too, where they line up their forehead, and you'll move that to do your obliques as well. So it allows you to take consistent, perfect before and after photos every single time with no interference whatsoever of natural light. Skin oil. Now this is really cool because it shows oil production on a per pore basis. It highlights them in white. She doesn't have much at all. But in this situation, same thing. You can highlight those in 3D, and it actually shows you an inverted per pore and the depth to which she has oil in her skin. So again, if she did have really, really oily skin, she's actually 195 gradients better than those of her age. So she has perfect control of the oil in her skin. But if this was an issue, same thing, your hydrodermabrasion, your IPL that's going to control your sebaceous activity. So many things that you can position as you go through these of all of the services that you're learning about today and that you will integrate into your practice down the road. And then porphyrin. Porphyrin is going to be the bacteria in your skin. So you're going to see a lot of this on your acneic patients. You have like a shallow wavelength IPL, a hydrodermabrasion, microdermabrasion, all of your topicals that are going to help control the bacteria in your skin. That's where you're going to position these. You do have the same capability. She has so little, but you do have the same capability if she did of highlighting that, inverting it in 3D and showing on a per pore basis the oil in her skin. Moisture. So we took the moisture reader on hers. While she was very moist, she could tend to probably drink a little bit more water. Maybe this is where we offer her some hydrating facials or laser treatments that are going to help improve the moisture in her skin, and or like a serum that's going to help with moisture. Okay, so these are all perfect ways that you use a skin analysis system in your consultation to provide continuity, not only in the consultation itself, but also in the images and the reporting. So you can have multiple practitioners doing these consultations. You can have your MAs doing the consultations and then sending them in the EMR to the doctors to run through the consultation. And it's always going to be the same every time. Now we'll go back to home. So now, as I mentioned, this screen is a lot of times where, because it started, it's kind of a summary of everything. I like to go back to this after I've gone through everything. This highlights each and every one of the things that we just went through, that she's doing great with all of these different things. These are the two that we are going to address. You have the opportunity of writing notes in here and saving this to the file. So then again, if she comes and she sees another practitioner or another tech within the practice, they can see your notes here. And then what I love is there's two different ways to send this. You can either email it to them or you can send it with a QR code. So it populates a QR code. They're going to use their phone here, and it's going to give them a screen with an unusual configuration of their birth date as the password. So it is HIPAA compliant in that it is password enabled, and they have to put that in order to see anything. It's the same way saved in the system. And they'll get to keep that. So maybe it's, I need to go home and talk to my husband today about all of these different things that you've been telling me that I need. And then they're going to look at these pictures, and they're going to be these crazy magnified pictures and all of these different filters. And they're going to come to you and they're going to say, I need all of those laser treatments. So that's the whole purpose of this. I'm going to highlight one more thing. So we'll go back. And when she comes in for her second or third or fourth, you can just type in the first couple of letters of her name, do your customer search, she pops up, and then we're going to go to her image records. Now, this is where you're going to have the opportunity to show those results real time. The challenge that we see in non and minimally invasive medical aesthetics is that the process of the improvement sometimes takes time. And so we look at ourselves in the mirror all the time, and those gradual changes are such that sometimes they come in and they say, I'm just really not seeing these results. This is your insurance. So you can actually do a singular treatment, and you can do it side by side to her next image record. So if you wanted to do side by side, and then she had another one in the same filter, right? This is your opportunity to show those results over time. And you can do 4, you can do 3. It will allow you to pull down based on the date that we did that analysis. There are morphing tools. There's things that you can go in and you can actually show what we can do to improve the skin real time. So if they did have, pigmented lesions, for instance, and you wanted to be able to show them what it would look like to erase those. So she's got one little one right here. So we'll just go over those and show her okay, this is what it would look like if we lightened up under the eyes, right? So side by side, there's just little different things that you can use to kind of show these. And like I said, it can be as complicated and as long as you want it to be, because you see how much you can do with these. You can measure the eyelid, for instance. So say they came in for an upper lid blepharoplasty or a non-invasive blepharoplasty. You can use, erbium YAG for that, or a fractional CO2 or full ablative CO2 if you want to with an eye shield. Taking this before and then showing the improvement in the distance between the brow and the bottom of the top lid is going to show her the actual improvement. So lots of opportunities with your skin analysis devices to further help you provide a great consultation every single time for your patients, but really to help you sell your treatments.